Okay, great. I'm going to get started, and I think people will be filing in through, but we have such a short amount of time. I think we want to take as much advantage as possible. Of course, at today's event, the recording will be available after and will be shared online so that others can take a look at this across time zones around the world. So today's briefing around India's COVID crisis is by providing the latest insights and advising on how to mobilize for impact. We're doing this high-level briefing with GiveIndia, and I will introduce our moderator who will introduce our speaker, the founder of 2.0 of GiveIndia, Atul, in just a bit. But before that, let me give a little bit of an overview around Globesight and what we're trying to do and why we're convening today's event. So Globesight, we work across the Middle East, South Asia, and Africa, as well as at a global level, in really advancing meaningful impact through building partnerships, platforms, and strategies for the SDG agenda. We work often collaboratively with others, often behind the scenes. But when we see a need, we definitely step up and put our advocacy foot forward, which we have today. If we go to the next slide. So, we do this through development of platforms and campaigns, joint advocacy, events and dialogues, and reports and trackers. Obviously, today is an event that we are bringing together. And in the past, we've also done campaigns and advocacy. We did that around the Beirut explosion. We've done that around the Syrian refugee crisis. And around COVID, we've been actively working in a number of areas. Really today, the crisis is very challenging in South Asia. And as we look at those numbers, they tell part of the story, the increasing numbers across the subcontinent where we work quite extensively, India, Pakistan, and Bangladesh. The challenges of the vaccination levels, but also then the health infrastructure, and really what is everything at once, which is bringing to bear just a severe challenge for the community in these countries and for people leading the response. Obviously, there is the deaths, which are also just very tragic, but there are a number of people hospitalized and who need support. And we have to find ways to step up. And so today, in bringing together this group, many people on this call are working in various sectors, the health sector, the global health sector, in philanthropy, with nonprofits, academia. And we know that many of you are already doing your part, but we really want to call on you to step up and to also step up with your partners, your friends, your colleagues, your organizations to do that much more. In that light, I want to announce on this call and in this briefing that Globesight will be making a contribution of $10,000 to GiveIndia's campaign, particularly around oxygen and life-saving support in India. And we are doing that not just to make that contribution, but to encourage our partners to join in that. And we will be sending around the links to that site that you can go to contribute alongside of us to this really important campaign. So with that being said, I want to introduce today's moderator who bring to bear what we're doing today at this event and engage with our primary panelist for today. So Rika Kumar, who is an analyst at Globesight and works across our social impact work, often engaging with multilateral global health and development institutions, and supports a lot of our partnership thinking around various aspects of the COVID response. So Rika, I want to turn it over to you to help lead our conversation today.
Great. Thanks so much, Taufiq. So firstly, obviously a very warm welcome and a big thank you to Atul for doing this briefing session and giving us a sense of how the situation continues to unfold in India. As you know, Atul is the CEO and founder 2.0 of GiveIndia, an organization that has been at the forefront of mobilizing assistance in India's COVID response. And I think a major reason we have gotten so much interest in this briefing is simply because people really do want to know how to help and how to best mobilize resources. So in this session, we will aim to assess the what, the how, the who, and the when in terms of assisting India's pandemic response. So in sort of the conversation with Atul, we're going to try and draw out where the situation currently stands right now, who the key stakeholders are, what resources are most needed, and where people and organizations can most effectively direct those resources towards in order to reach those who are the most in need. Now, again, obviously, this discussion will cover specific ways to overcome the dire health crisis and how external actors can play their part. But at the end of the day, the sort of information saturation that people have been experiencing regarding how the pandemic is unfolding in India right now is something that we are trying to overcome. So turning this to Atul, as I mentioned, so given that GiveIndia has been at the forefront. Sorry, can everyone hear me on this? Taufiq?
Yes, yeah, go ahead, Rika.
Yeah.
Okay, all right. Sorry, I think I was having a problem with my mic. So given that GiveIndia has been sort of one of the organizations at the forefront of the response, and in that sense has a slightly clearer sight of what's happening on ground and how India has gone from this sort of first wave to a much deadlier second one, I wanted to sort of turn the floor to Atul and ask him, how long has this current crisis been going on? And how do you think it reached this point?
Yeah, thanks, Rika, and thanks, Taufiq, for inviting me here. All of us have been following the news. We've seen the numbers. It's been a month now that we've seen the numbers climb up and start to break out from the rest of the countries in terms of the climbing that we're seeing on the positivity rates. But I don't think it started there. I think it started much before. Part of it was, as we were coming out of the first wave, we realized that as a country, there is a lot of, in most developing countries, the civic behavior is very difficult to moderate because of lower literacy levels, all segments of strata living together. And the behavior is not homogeneous. Everybody's life constraints and lifestyles and living conditions are very, very different. So in that heterogeneity, very quickly what started to happen is that as things started to get normalized at the end of first wave, a lot of people started reaching out and saying, oh, you're not in office yet, right? So people were starting to be in office. People were starting to stop wearing masks in private places. You started seeing house parties starting to happen. And people starting to take off, the guards that we all had for like 7, 8, 9 months, 10 months last year. I think what aggravated that situation, while people were starting to sort of be loose about it, is that I think there is this thing about vaccination is here, and we can go and get the vaccines. I think what that started to do is give everyone a confidence that now that elderly are vaccinated, we have to be as careful as we were some time back because of our parents being home or something. I think somewhere that social behavior is starting to be loose, coupled with the fact that there was sort of this sense that vaccines have arrived and people are getting vaccinated and now we'll be out of it. So it's almost like when you're about to see the finish line, people started thinking like it's a finish line of COVID, vaccinations are there, and their social behavior started to change. And very tough to pinpoint the super spreader events within India, because I'm sure there were like thousands of them across the country, but I think it just picked up. I think what is unclear, which nobody has been able to pinpoint yet, is was it the strain, the newer strains that caused a lot more spreading, or was it just the social behavior, people being relaxed and things like that, which caused it? But it's been only the last 1 month that we've seen India break out from the rest of the countries in terms of curve. And it happened just so steeply that I think nobody got a time to respond to this at all. As a country, we weren't prepared. India's healthcare spending is already very, very low compared to most countries. So when the healthcare infrastructure wasn't ready, and this sort of exploded out of proportion, the number of deaths we see, or the beds that we don't have in hospitals, or ventilators are not there, things started to look really, really bad there. So yeah, it's in some sense our own created mess.
Fair enough. In terms of sort of where we've come to now, obviously things are changing every single day in terms of what the realities are. What does the situation currently on ground look like, and how are needs evolving? And would you say that sort of they're evolving very rapidly, or would you say there's sort of like a gradual change in them?
Multiple parts to your question, Rika. See, in terms of the needs on the ground to serve the civil society, like the people who are struggling, it started with hospital ICUs being crowded, right? Because people weren't prepared, they were at home. Even if they had symptoms, they were staying at home. And the situation went bad, and they went to the hospital, and they were quickly led to the ICU, and ICU started to be very, very full. Fortunately, we had the ventilators in the beginning, and people were able to sort of see that infrastructure there. But when the beds started to not be available, they realized there are no ICU beds anymore. And when people needed oxygen before they went to the ICU, we realized that we don't have the capacity to provide oxygen at the scale which we need. And certain cities that were the first ones to see this wave, Bombay in particular, Pune, Nasik, Nagpur, like 3-4 Maharashtra cities, and Delhi as well. There we started the sort of the strain shift from ICU beds to oxygen. When I say oxygen, I mean the oxygen cylinders to control the flow and handle all patients, or concentrators, 10 liters in particular. The minute we saw that strain, it started going upstream to say we also need to have cylinders at home, manage 5-liter concentrators at home. And that panic started setting in, which is sort of starting to create a huge stress in the system on the supply of oxygen and where it is. So now people are in that panic zone on, so what's going on here, right? How do we do it? And so that's one part of the need, right? It's moving from ICUs upstream to oxygen in hospitals to oxygen at home. And that is now starting to go upstream and saying that now we need to just like super self-isolate and not touch anything, and be back to where we were last year, March or so. I think it's also, the needs are also different when you look at what's happening in cities versus rural areas. I think we took some time to react, and I feel we are still very slow. Like this wave started with big cities in Maharashtra, it went to Delhi, it came to Bangalore, it was in all different cities, but we were not seeing as much of these things happening in rural areas. And there is no reverse migration this year to take the disease very, very quickly into all parts of India. There were no lockdowns this time, right? So like the mobility across the country was not zero, but it wasn't as forced as it was last time, where the whole country was sent back, and people could take the spread of the virus to a different level. But still, we did not contain the rural areas fast enough when we were starting to see a new strain or sort of much more viral sort of situation with this strain. And what's starting to happen, as we see right now, is that while cities, Maharashtra in particular, plateaued very quickly, and there are many models that say that as fast as the virus numbers, the caseload went up, the caseload will come down very, very quickly as well in Maharashtra. And the numbers are starting to hold up in the last 8-9 days, as we've seen the models that some people built before. So many people believe that this wave will also come down fast, but because of the largeness of India, by the time every city, every rural area, every town goes through that, it'll be very, very catastrophic for the country. So the need in rural areas is still very different than urban areas. There is no oxygen, but there are also no doctors. In cities, you are struggling for oxygen, you provide oxygen, you can make somebody stable, and somewhere, if you become critical, there are doctors around. We are struggling with that in cities, but rural areas, there is no healthcare infrastructure available at all at the level we need. So there, I think there is still a lot of room because, given the population size, we still have a very, very vast hinterland. And there we have not started doing social behavior drives once again, sanitation drives once again, communication on how to handle when you are mildly symptomatic or asymptomatic, testing happening early enough, and things like that. So there's a lot of work to be done in rural areas that is more sort of hygiene and 101. But in cities, we have to handle on the a lot more on the oxygen side right now, which is what we are seeing globally as the biggest need for us.
Fair enough. That's very interesting to know, actually, that staffing is sort of an additional burden to be considered in rural areas, given that there aren't enough doctors to kind of take care of whatever cases that you're seeing. So just in terms of needs on ground, you know, you hear very often that oxygen is needed, but what specifically about it is in shortage? Is it the concentrators? Is it the cylinders? Is it the gas itself? Is it transportation to get it from one point to another?
Yeah, I think that's what's on everyone's mind right now worldwide. Like, what's this oxygen puzzle of India? See, oxygen in all the forms is what we need right now. There is industrial capacity for oxygen that is now being converted to medical grade oxygen capacity in plants. I was having a chat with the Linde India, which is the largest domestic manufacturer of oxygen, yesterday. And they were telling me that there is some capacity in their plants to shift capacity from industrial oxygen to medical grade oxygen. Even if they do that, the transportation of that oxygen to the cities where it is needed is not that very easy. You roughly have like 1,000 miles, 1,500-mile difference from where the oxygen is to the big cities in north and the west and the south, where the biggest sort of cases you're seeing right now. So there is a geographic inefficiency about this. And I think Indian Railways has done a very good job in quickly supporting all sorts of liquid transportation. The cryogenic containers that we have, they're able to sort of move it around and very quickly give support. But the containers themselves are not available, right? The ISO cryogenic containers in which you have to move liquid oxygen is not available. I know that people have imported 30, 40, 50 containers, but the demand in India is roughly about 200 containers to be able to ship very quickly. And they also have to go back, right? So do a two-way so that the industrial capacity is fully utilized and we are not wasting days in transport or in capacity. You need to like 6x the number of containers to be able to move oxygen. Now, while that is happening, we also don't have enough capacity to refill oxygen. So refilling stations where you vaporize and put it in cylinders, they also have a capacity constraint. One, we don't have enough cylinders right now. And when you have cylinders, there is a capacity at the refilling stations from this. Now, a lot of people, what they are doing is they are saying, instead of moving oxygen from industrial plants, converting it to medical or increasing capacity and moving to cities, why can't we create oxygen generation plants and put it in cities? But the reality is that these oxygen generation plants that you put in hospitals on premise at the top, whether they are 100 liters, 500 liters, 1,000 liters, there are varying sort of capacities. They are not available in India as easily, right? So there are some organizations who build these plants, but building this plant takes time. We don't have the installed capacity. And when you build it, they take 4 weeks for that entire thing to be sort of finished, moved, installed, and then start to be put in use. And when you put it in a hospital for use, then a hospital is sustainable forever, beyond just the need for cylinders to move it, or you have a piped gas that goes to the beds of the patients. So we also need oxygen generation plants, which are very difficult to import. And India is investing in that, and the capacity is increasing like it happened for PP last year. The third thing here is that the concentrators, 5 liters per minute, 10 liters per minute, all these concentrators are also in huge short supply. Now, hospitals need at a minimum 10-liter flow. But for people where oxygen saturation levels are in upper 90s or so, people are very comfortable. 5L is good enough. So what's happening is that there is not enough supply of 5L and 10L in India, concentrators in general in India. So people are trying to import it from various places, and most of that manufacturing is in China. There is some in US, there is some in other places, but most of it is in China. And bringing it there, like placing the orders, increasing the manufacturing volumes there, then shipping it to India is not that easy because they're also very heavy. Each concentrator is 15 to 20 kgs. Sort of a normal 5L is about 18 kgs, 20 kgs. A 10 liter is 23, 25, 27 kgs, depending on the quality and the make. So bringing them also in a cargo is not easy, right? If you have 5,000 OCs lying in China, you need like 10 aircraft to get that load into India. That is also causing a lot of supply chain delays where there's a material sitting there, it's been paid for, but is not reaching India in time to save lives. Now, we at GiveIndia have 9,300 oxygen concentrators we have ordered, right, last week. But the shipments are coming this week, and some are still not lifted because they are coming plane by plane, one by one. So it is very painful to see that, you kind of gathered support, you place the orders, material is also ready in many cases because it started early, but to bring them to India now, we have to get it one by one. And then it has a road transportation to get. And remember, all this is last 15 days wake-up call, right? That this panic has been around for. So concentrators are also is a huge issue. And then there are cylinders which are extremely heavy to import, and they're also in short supply.
Great. That's really helpful to know, just in terms of how the oxygen supply crisis breaks down in terms of different elements, because often you just see it flagged as India has an oxygen supply crisis, but in terms of people looking to give and looking to contribute to specific causes, I think that's useful information to have, definitely. In terms of sort of the key stakeholders in the situation, both in terms of where resources are being directed at a federal as well as the state level, and in terms of the actual COVID warriors on ground, volunteers, doctors, etc. Who do you think are the key stakeholder groups here, and how do you think that feeds into decisions for where to direct resources?
Yeah. So Rika, that's a very good question, but also complex one in this way. There's a huge role that central government has to play, can play, because ultimately it's containing a virus that's at national level, right? As many of the social media campaigns say, no one is safe unless everyone is safe, right? And we have to make sure that every last person is safe. Otherwise, you have a third wave and the fourth wave sort of risk that people talk about in a sort of alarmist tone. So there's a huge role that central government has to play on social behavior, messaging, communication, labs and research. We're not doing enough sort of sequencing and work in India to even understand what's happening with the strains and what's the behavior and things like that. There is also a role that central government has to play in making sure that the regulatory environment for everyone else to play and support and contribute is very conducive. Fortunately, the government has done a great job. The customs duty, the IGST have been waived off temporarily for 2 months, which allows us to be able to have concentrators, let us say 12% cheaper now than it was last week. Custom duty has been waived off. So government is doing what they can to make sure that we are able to get the supply from outside, no matter where it is coming from, which is very useful. But I think the areas where central government could do more, and I think a lot of requests that nonprofits have made is, India also went through a law change where FCRA donations cannot be sub-granted, for example. So if I have a foreign aid, I want to help a nonprofit on the ground do something, I can't sub-grant in India. That's something that we are requesting government to consider changing once again. So there are roles that central government has to play on the regulation, environment, laws, taxation, and stuff like that, and social behavior and research. When it comes to state government, that is where the sort of the real ability to control at least the healthcare crisis is. Health is a state subject. So the control of hospitals, the doctors, the medicines, the PHCs, the entire value chain of local value chain of healthcare service delivery is in state government's control. And there, we have seen that there is a lot that state governments can do, and the response to COVID in each state is very different. I think some state governments are still in a state of denial that it's that bad. And I don't think the action is on the ground as urgent or as big as it needs to be. There are many state governments which are actually doing a really, really great job, but it is just that they just don't have the virus in control. So they are battling a lot, they are responding to it, but it is just that the caseload is very, very high. But state governments are the ones that need to isolate people. We have to remember, guys, that unlike many countries, 35 to 40% of our urban population in big cities, Bangalore, Delhi, Bombay, lives in slums. The slums are kacha roofs, right? They are temporary looking roofs, but the people who live there are permanent. The average age of a tenant in that house is 5 years, 7 years. So these are temporary establishments, but these are not temporary residents, right? Now, when they are living there is no way that they can self-isolate, right? They are sharing a shared single space. Even the ones who actually have pakka roofs under their head, over their head, they're also living in houses that are a single room house. So if a virus catches, if I am sort of affected by COVID, I will spread it in the house for sure, right? Unless I am tested very early before I spread and isolated. And if civic society cannot isolate, then government has to quickly isolate them. And we saw that in many countries. So we need a mass isolation centers where you are able to provide basic care for people who are asymptomatic or mildly symptomatic despite being positive. And we don't have enough capacity of that. So cities are suffering from there. In rural areas, it is not very dense living, right? So spread is only when you're not, it's very easy to be, to control the virus in rural areas if people are maintaining distancing, which is very natural there. But in urban settings, that's very difficult, and hence behavior is the most important one. And state governments have to make isolation centers and bring people out. The other actors here, Rika, is that civil society is feeling a lot more helpless this time than they were last time. Last time we could go out on the street and feed people. Last time we could go out and give people sanitation kits. We could go to a community and do social behavior, conversation, stuff like that. This time, everybody's eyes are on healthcare infrastructure crumbling, and there is almost nothing that civil society can go and do in a COVID facility. Plus, the bottlenecks there you can't solve for because they're coming from the supply chain of oxygen and other materials not being there, BiPAPs, HFNCs, ventilators, stuff like that, right? So unless you unclog that entire supply chain of medical equipment and supplies, the minute they start to happen, we'll realize that there is no healthcare doctors, paramedics, and nurses which will actually go and attend these patients, even if we increase the capacity. And government is doing some stuff around allowing finally MBBS students to come and serve. So there is that capacity of that. So all of this is in the state government realm, and NGOs can only help in sort of raising philanthropic money, bringing concentrators, at each sort of possible port and station.
So Atul, given sort of this supply chain problem right now, what are other ways that donors, especially those not in India right now, what actions can they take to have some sort of a positive impact on the situation? Given that, there are these supply chain problems, are there other ways that donors can help?
Yeah. I have seen there are a lot of people who have resources outside India, and you'll be surprised that every country has oxygen capacity. I'm sure in UAE there is oxygen capacity. It's industrial, maybe not be medical, but it is there. It's there in US, it's there in China, it's there in Thailand. So I think one of the things that we realized is that as we went and started looking at more avenues, we found that volunteers in US are able to find a nearby plant where there are machines being made for army in US, which actually is comfortable for industrial use, and they are oxygen plants. So each device is 150K, but 9 of them are being unsold to their patients, and they're actually being shipped to India, right? So I have seen that when people look at, okay, how do I solve for oxygen and not money? Then suddenly you find that you will find oxygen around you, like in some plants, in some facilities, in some way. So, so a lot of people are looking for outside India to say, how do you take it in the short term? Obviously, that's not the answer, right? We have to increase the internal capacity very, very quickly. There is that as well. I think donations are not, sometimes it sounds like it is such a large problem. How can I contribute? What will my sort of $1,000, $10,000, $50,000 do? But the reality is that, if it is our kid, that $1,000 saves life, right? But if somebody else's, we suddenly look at very large numbers. A caseload of, Bangalore is now sitting at active cases of about 400,000, right? So the minute you see India is seeing 400,000 daily cases, new ones, and you say, okay, I can't do anything. But I think the reality is that there is such a large diaspora for India, such a large population base in India. And while we figure out how to control the virus, make sure that everybody is vaccinated, you still have a 9-month battle with the virus, even if vaccines work in all the current strains and the future strains. Even if you assume that vaccines are fully effective and they will solve the problem, the current ones also, you still have a 8-9 month journey for India to be fully comfortable in a place where, like most people are vaccinated. And hence, till that time that happens, like every dollar, every ounce of support is needed. It's just that scale is large, and if everybody chips in, you can start to make a dent.
So in terms of sort of the timeline of where this current crisis is going, I mean, obviously, I know you're not like an epidemiologist, but in terms of just what you're seeing on ground.
I wish they had answers.
But in terms of, what trajectory you think it's likely to follow and kind of what point we can expect to see a conclusion, sort of best and worst case scenario, what are your thoughts on that?
See, the scale of the country is so vast that you have to take it at a city level or at a state level. At a national level, it is very, very difficult, right? We have seen that in Maharashtra, there are many models that government built and many foundations built. And actually, some of them are turning out to be how they predicted, where it'll be a very steep curve and a very sharp decline. And we are seeing that the cases in Maharashtra have come down very steeply, starting to come down very steeply. So I hope that it's a sort of 1.5 month sort of jump and coming down of this. So I hope that a wave lasts like 2 months in a city, and then we are sort of on both ends, like very, very small number of cases. But I think what's happening, it's traveling across the country. I was on a call with somebody who's 2 hours away from Lucknow. And these are actually a doctor couple, right? Husband, wife. And they moved there to actually create a non-profit, and they've been serving there for more than a decade. They both said that the local PHC, if you go there, the nurse is wearing a mask where the nose is exposed, right? There are no sort of PPE kits in that local facility. And every third household, he said, is affected. Now, I don't know what to make of the numbers because the numbers don't reflect that in that particular area, but every third household, he said, is affected. You see COVID symptoms, sometimes testing kits aren't available, sometimes test results are taking 4 days, and by then it's just too late. And even if they are tested positive, they are at home, with others and stuff like that. While I was having a call with them, it was 11 in the night, and there was this wedding procession outside the Bharat, and nobody there is wearing a mask, right? Like imagine 100 people in a tier 2 city with every third household affected, with no healthcare infrastructure, exposing themselves so much. Like it's not a surprise that 3 weeks later you realize that there are sort of things that you don't want to hear will come out, and that's everywhere. So I think it's a 3 to 4 month journey, given where the vaccine supply and demand gap in India are, for us to see this, that we are able to sort of control it. So it's 3 to 4 month journey is what I feel. If I'm really lucky, 2.5 months, it just very, very quickly dies down and doesn't go very, very deep into the rest of the country, right? Like the big cities control it and the numbers die down. But if we don't do a good job, it could even be like 5 months, 6 months, which means vaccinations are the only one that will come and control it, not the collective work that's happening around us.
Great. Well, I mean, thank you so much, Atul, for giving us sort of such a comprehensive look at what's happening in India, and especially drawing out that distinction between the rural areas and the cities, and how sort of the crisis is going to unfold at different rates in both. I think we could maybe take some questions now from the audience. I can see one sort of on the chat. I think the key question really here is, what is GiveIndia thinking in terms of, the post-pandemic economic crisis that is likely to unfold at the end of all of this, given that, obviously people's earning capacities have been severely affected, the mortality rate has gone up. Sort of, is GiveIndia doing any longer term thinking on that, or is it just kind of like an all hands on deck response to the crisis right now?
Yeah, see, there are remains of war, right, that you have to count later, and you have to sit down and say, how do you sort of handle the damages? But in the war, it is very difficult to look at, the damages around. You have to just fight to win. Right now, it is, like you said, all hands on deck, solving for how do you make sure that people are getting the beds, make sure they have oxygen when they have the bed, and make sure that we are able to support them to come back home healthy with all the medicines that are required. Like that is the big thing we are doing right now. But the question is more about how are we looking at the economic crisis there? See, the challenge is that it is not just the economic crisis. Last year, when the lockdowns happened, we realized that it started as a livelihood crisis. People went back home in the villages. The cases of domestic violence in all the cities in India went 5x because you are all in the lockdown in the house the entire day in a very stressed environment, and all sorts of mental health stress, all that goes into and start affecting second, third order impact of that, like mental health, domestic violence, and things like that. Even if you look at the job loss and the stress of that, it starts to touch all the other things as well. Last year, we saw that the girls were taken out of school to be able to make money to pay the loans that they were not able to pay in the months that there was lockdown, right? So there's a gender crisis that we saw in communities in rural areas because of the livelihood crisis that we saw in cities. We saw the education crisis because of that. So it's sort of a ripple that sort of travels and grows, unfortunately. On the livelihood crisis itself, we saw that many nonprofits, including the Nudge Foundation, which I run in parallel with GiveIndia, started doing a lot of livelihood projects. So for example, we are running a program in Uttar Pradesh where we are working with about 500,000 families, 2.5 million people, where we are trying to rebuild their livelihoods post the crisis. So you're saying, how can they get the social welfare right now that they're entitled to, whether it's a right to job or right to rice and pulses and grains? And once they have the social protection to have basic food at home, consumption at home, then can you build their livelihoods on top? Which means they are able to make a kitchen garden work, or they're able to have a cow or a goat or things like that to make their livelihoods work. So a lot of that work is what we are doing in rural areas. I know of many, many nonprofits who last year, when the COVID wave came down and they were seeing the crisis on the livelihood side, had started picking these projects. But now again, all of that is stopped right now. So we'll again have a 4-month, 5-month sort of, it's like one step forward, 2 steps back right now.
Yeah, but it's great to know that sort of this planning and thinking is happening in parallel to sort of the crisis sweeping everything else out the door for most people in India. We can go to another question now. So there's one that asks, how is the business community in India mobilizing? And are you seeing a coordinated effort, or are businesses taking individual action?
I have seen that government is trying to bring collective action. I was on a meeting with the Niti Aayog CEO and a committee and a panel of nonprofits together just before this call. They were all sharing what we should do, our feedback to Niti Aayog, the Planning Commission of India, to organize and coordinate the response here. I've seen state governments also try to do that. Not all state governments are effective, or not all central government initiatives are effective, of course, but it is happening on the government side because they need that support for everyone to come forward. I see the same thing happening in the non-profit and development stakeholders as well, like foundations, non-profits are coming together and collaborating. I'm a part of 2 or 3 of such community collaborative initiatives where people are pooling resources, for example, to buy oxygen. There's a very large initiative in the pipeline through Action COVID team where they are aggregating everyone's demand and seeing how can we help procure from China. And all of us are pooling resources to be able to have bulk orders placed so that we can, one, control price, and 2, more importantly, be able to have a handle on oxygen coming into India, so you can coordinate the delivery and distribution of oxygen based on the requirement that's based on data, but allocation that is also fair and equitable when oxygen comes in. So that part is happening. In businesses, I don't see it as much as I see in the government, in this case, in particular in this case, but in non-profit. So I see more collaboration happening on the ground with various people coming together, a little bit less on the business side.
All right. So just to sort of round out this session, this super helpful information session on what's going on, what would you say right now, for those on the call, what is the need of the hour? If you had to choose one.
Yeah. such a difficult one. I think the right answer is to focus on vaccination 2 months from now. But today's biggest need is, as a society, being able to save the lives that we are losing. You can't solve for all the pain. You can't solve for all the hardships. You can't solve for all the stress, money, all the efforts that are going in. But I think the biggest sort of losses we have is we are losing people every day who otherwise could have been very easily saved. And that is the biggest bottleneck there is healthcare infrastructure capacity, especially oxygen. So we first have to solve for that. Now I see a comment here from Harjeet saying, have we ordered enough oxygen? And the answer is that we don't have a handle on how much oxygen has been ordered collectively as a nation. But we know that the manufacturing capacity of oxygen in China and in India put together is sufficient. Have we ordered enough? We don't have a coordinated answer, but we know that a lot of capital has been deployed to do that. But the problem in these things is very tough to know what is your need, because need is ever changing as the curves are evolving. So enough is such a complex number, the complex concept here, that it is okay for you to provision for 2x than you need and be okay with losing that money than under provisioning and losing thousands of people. Now, it's not an efficiency that should be the priority right now. I wouldn't worry if somebody in my family is sick about the efficiency of money. I just want to save that life, right? So we shouldn't be thinking differently for society. It is very important for us to realize that 3,000, 3,500 deaths a day, 40% coming from poor backgrounds, right? They can't even afford private healthcare, even if you have it. So public infrastructure, having oxygen, all of that is needed at large scale. We have not started seeing large scale shipments come for oxygen. So even today, there is a lot of nervousness, right? I have 9,300 concentrators ordered. I don't have 1,000 on the ground here. And the dates that I thought I'll be able to bring it in India has slipped by 8 days in the last 12 days. So are they coming on 9th or 10th or 11th or 12th or 13th? You're sort of permanently nervous about that with all the sort of supply chain issues. So I think we are all going, you might see sort of oxygen hyper shortage to maybe a little bit of oxygen glut. But I think it is wiser to do that than to underestimate, not order and lose thousands of people. I think there is a lot more work to be done on oxygen still. We haven't solved for it. I think the second big thing would be just making sure that government is able to support with enough doctors and paramedics. The minute you solve for oxygen, even if you create bed capacity that government can create very quickly, converting public properties into healthcare facilities, bed capacity won't be an issue, but oxygen beds and ICU beds will be an issue, which require philanthropic capital or with given enough time, public capital, which is not.
Well, thank you so much for that, Atul. I think what you said last really stands out, that enough is a complex concept. And especially when you're thinking about almost 1.4 billion people, it is difficult and complicated to sort of quantify a response, really. But I think I speak for everyone on this call to say that this was a very helpful information session, especially for people who are concerned about the situation in India and want to help as best as they can. Taufiq, I think I'll hand it back over to you now.
Yeah, I mean, I think just, before we move into a few closing thoughts, and thanks, Rika, for guiding this conversation so expertly. Atul, just in terms of the model of GiveIndia, people might not be familiar, with it, and we're talking about contributing. I mean, how does that work just financially? People from abroad, within India, how do you receive it? Who do you end up giving it to? How do you use funds? I think that would just be helpful to elaborate for the audience.
Yeah. So Taufiq, what we do as GiveIndia is that we are a giving platform. Over the last 20 years, we have done all the big things in giving in the country came out of GiveIndia. We brought marathons to India in 2001. Now we have 1,000 marathons that happen in India a year, 3 a day. We started HNI giving, UHNI giving, giving pledges, giving festivals. So all of that came out of GiveIndia. In this journey, what we ended up doing is that we have a large network of non-profit partners in communities across the country that we have verified over years. If you tell me, what happens in Bastar, for example, as an area, or Bundelkhand in UP, or next to Indore, or Shivpuri, or we have nonprofits across the country that we work with. Here we have looked at their books, we have looked at their business models, their board, their team, the capabilities, the programs, the pricing, stuff like that. So when something like this happens, we are in a very good position to be able to, on a relative basis, respond very quickly and say, hey guys, this is what I need in Chennai, this is what I need in Himachal Pradesh, this is what I need in Assam, because we get the request from everyone across the country. When COVID happened last year, we worked on many other sort of pieces of the puzzle, but we were able to mobilize 200 nonprofits across the country and give a scale of 117 cities where we could work within a matter of 2 months. Now this year, what we are doing is we've launched the India COVID Response Fund 2. Last year was 1. And in this India COVID Response Fund 2, we are gathering resources from people. Those resources are going in 4 or 5 work areas. The first one is physical infrastructure, where we are trying to create isolation centers so the spread is contained in cities. We're working on ICU beds and oxygen beds. We are not working on physical infrastructure and beds that governments can very quickly provide. The second bucket of work is medical equipment and supplies. So oxygen generation plants, concentrators, cylinders, ISO containers, which so far we haven't done, but we want to. These are the sort of things we are doing. And in rural areas, even simple stuff like masks and gloves and PPE kits and basic medication. These are the medical sort of thing. The third thing we are doing, we started doing vaccination support like a couple of months back before we went into this way. We want to support vaccination that the government will be driving across the country, whether it is vaccination on wheels so people don't crowd the vaccination centers. I'll give you an example, right? I have cases where people go to vaccination center 1 hour early. When the appointment comes, they need to wait for an hour because there is a backlog because somebody went for lunch for an hour. Now, the reality of all this is that you're going to vaccination centers, crowding them and getting the virus even before you get vaccinated. And there are examples of people who first time after 8 months went to vaccination center and came back infected. So you need sort of support for people for scheduling capacity, running vaccination centers, informing people and stuff like that. So vaccination support is a huge area, both in urban areas where you do vaccination outside and skilled. In rural areas, you have to find transport for people to go to vaccination centers or vaccination to go to their households. That's a third area of support. The fourth one is more humanitarian. Food and dry rations. We are giving $400 cash one time to anyone who's losing a loved one to COVID. So we're transferring this $400, no questions asked, to the families of deceased, as long as their income is below 3 lakh rupees a year. So that's sort of the intervention areas for us, Taufiq, right now. We are running a website called covid.giveindia.org, and people can go there, look at the various programs. There are some more granular programs there as well, and contribute. And for larger amounts, they can obviously contribute through wire transfers and stuff like that, which we can share.
Great. No, so I think, it's very important because, there are a lot of avenues to go to. Obviously, I think we encourage everybody to look at what makes sense for them, both in their countries and their contexts and their networks. But I think, our partnership today, with you, Atul, and I think in what we're thinking about as this issue unfolds is as much as we can coordinate, as much as we can channel to the networks, the nodes, and I think GiveIndia is in that position, not just overall in terms of your history, but in this COVID crisis. It takes a while to build up the familiarity, and we've seen this in other countries with regards to the crisis that you might have the PPE, etc., but that's only the first step of the journey. And you described that effectively, but we've seen the same thing across the board, right? Once it gets to country, how do you distribute? Is it correct? Even if it's culturally appropriate in terms of some of the PPE, in terms of the oxygen, does it work in actually some of the infrastructure? So you can go through a whole process, and if you're not solving those, we're not solving that challenge. So, once again, we'll send out after this call kind of what we're doing and where you can go on the links that Atul mentioned. And of course, for more bespoke kind of partnerships, definitely that's something that can be kind of communicated to us and we can make that connection. I want to say just in closing that this is the start of a conversation, obviously a start in this phase of that conversation. This crisis, as you mentioned, in really 15 days, we all woke up to say, wow, this is really going to reach a level that we didn't even anticipate before. But as one of the comments mentioned, that the repercussions are going to be with us for quite some time in India and in a number of countries. And I think we need to all continue not just to contribute, but to be in this conversation and to challenge to solve the wider and systemic issue around vaccine equity and access. I think this really does not end until we get that down. And I think that is going to mean speaking some truth to power in addition to just mobilizing resources. We really need to make sure that we can enable that access and overcome those obstacles. So we'll be doing a little bit more on that side of the conversation in future. I think we're really in that emergency setting right now, and we all need to get kind of on board. But this is not the end of that conversation. We realize those wider issues, and we're definitely going to come back to that as Globesight, and obviously Atul invite you into those as GiveIndia and your colleagues. So once again, thank you, Rika, always, and today for the guidance in this conversation. Atul, thank you to you and your team for all the work that you are doing and for your remarks today. And thank you to everybody on this call for participating, listening, and championing this important cause. And Atul, in one sentence, what do you want to leave everybody with? Very quickly, what message?
I would say that if you are thinking about how to help, just take the first step. Pick a phone call somebody in India, tell them you're there for them, contribute to your community, whichever area you come from, whoever you know. Just take the first step and help. There is nothing more important than just taking that first step and helping right now.
Great words. Thank you, Atul. Thank you, everybody. And have a good morning, a good afternoon, and good evening, wherever you are in the world. And all our best to the people of India.